Vancouver Kingsway.
Thank you, Mr. Speaker. I'm pleased to rise and speak in support of Bill C-252 today, which has the laudable goal of prohibiting food and beverage marketing directed at children of unhealthy and damaging materials to their health. This legislation, Mr. Speaker, is long overdue. By way of background, Canada's New Democrats have been advocating for a ban on healthy food and beverage marketing to children for many years. In 2012, over 10 years ago, the NDP Member of Parliament for New Westminster Burnaby introduced legislation to expressly prohibit advertising and promotion for commercial purposes of products, foods, drugs, cosmetics, or devices directly to children under 13 years of age. You can tell already from that short list, Mr. Speaker, that the bill was more ambitious than the one that we're discussing today, which deals only with unhealthy food and beverages, but deals and engages with the very same concept as is before the House today. In 2016, as has already been heard in this House, Senator Nancy Greene-Rain introduced the Child Health Protection Act that was called Bill S-228, and that legislation would have banned the marketing of unhealthy food and beverages in a matter that was primarily directed at children under 17 years of age. And I'll touch on this a little bit later, Mr. Speaker, that this bill has reduced that age to 13. And of course, under 17 would have been more ambitious. And as I will advocate in my remarks today, that would be preferable. Now, Health Canada held an online consultation in 2017 to seek feedback on restricting the marketing of unhealthy food and beverages to children. That's over 6 years ago. That consultation was open to the public, health organizations, industry, and any interested stakeholder. At the House Standing Committee on Health, at that time, though, the Liberals unfortunately amended Bill S-228 to reduce the age limit from 17 to under 13 years old, and they also added a 5-year legislative review, which I think is a prudent measure. Now, according to UNICEF Canada, the proposed age cutoff of 17 was more likely than a younger age threshold to protect the most vulnerable from harmful impacts of marketing. While there are different interpretations of children's evolving cognitive capacities, research does suggest very strongly that teens are exposed to more ads than younger children, and they remember them better. They also have more means. Teenagers who are 15 and 16 years of age often have more expendable disposable income and are act in a more unsupervised manner and are more likely to purchase unhealthy foods than children under 13. Yet, I think due to pressure from the industry, that threshold was reduced to 13. Now, although Bill S-228 did pass third reading in both the House and the Senate, unfortunately, that bill died on the order paper due to a conservative filibuster in the Senate prior to the 2019 federal election. So that has left us to where we're at today. I would also comment that the Liberal government has made a number of commitments since they were elected in 2015 that remain unfulfilled on this issue. The former Liberal health minister, in her 2019 mandate letter, was directed to, quote, introduce new restrictions on the commercial marketing of food and beverages to children, end quote. That was never followed through. The current health minister's 2021 mandate letter instructed him to support restrictions on the commercial marketing of food and beverages to children. I suppose it can be said that he is supporting that in the sense that the government side is supporting this legislation, but we must remember that there's been no action from this government. This is a private member's bill that we are dealing with here, not a government bill. Now, what is the result of the inaction? It's not benign. Mr. Speaker, the marketing, each year, the Canadian food and beverage industry spends over $1.1 billion on marketing to children. Now, this marketing appeals to children through product design, the use of cartoon or other characters, fantasy and adventure themes, humor, and other marketing techniques. Clearly, these techniques work with children as young as 3 years old who are brand aware and can recognize or name food and beverage brands. Now, this marketing to children means that over 50 million food and beverage ads per year are shown on children's top 10 websites alone. and their personal identifying information is collected from websites and apps for the purposes of further targeting online marketing. Children in Canada are observing an estimated 1,500 advertisements annually just on social media sites alone. And nearly 90% of food and beverages marketed on television and online are high in salt, sugars, and saturated fat. That's what we as policymakers are faced with in the current situation. Now let's look at the facts. Poor nutrition and unhealthy food and beverages are key contributors to poor health in children. Good eating habits and avoidance of unhealthy food are key preventative elements of health policy. Now, there is strong agreement among leading Canadian pediatric and allied health organizations that the impact of food and beverage marketing is real, significant, and harmful to children's development. Marketing to children has changed dramatically in the last 10 to 15 years. Today, it is a seamless, sophisticated, and often interactive process. The line between ads and children's entertainment has blurred, with marketing messages being inserted into the places that children play and learn. Marketing of food and beverages to children in Canada is largely self-regulated by the same industries that profit from the practice. Now, research reveals that these voluntary measures are not working. Numerous studies have found strong associations between increases in advertising of non-nutritious foods and rates of childhood obesity. One study by Yale University found that children exposed to junk food advertising ate 45% more junk food than children not exposed to such advertisements. In Canada, as much as 90% of the food marketed to children and youth on TV and online is unhealthy. 3/4 of children are exposed to food marketing while using their favorite social media applications. And again, the majority of those ads are for unhealthy food that is ultra-processed and beverages that are high in saturated fat, salt, and sugar. Now, this doesn't just affect children. Canadians are the second largest buyers of ultra-processed foods and drinks in the world, second only to the Americans. The result? Nearly 1 in 3 Canadian children is overweight or obese. The rise in childhood obesity in recent decades is linked to changes in our eating habits. Overweight children are more likely to develop health problems later in life, including heart disease, type 2 diabetes, and high blood pressure. Now, children are uniquely vulnerable to marketing manipulation until the point that they achieve 2 specific information processing skills. First, the ability to perceive the difference between commercial and non-commercial content, and second, the ability to understand the persuasive intent behind advertising. Before the age of 5, most children cannot distinguish ads from unbiased programming. Children under 8 do not understand the intent of marketing messages, and they believe what they see. By age 10 to 12, children do understand that ads are designed to sell products, but they are not always able to be critical of these ads. Mr. Speaker, Canada needs to get in step with other countries in the world. Other jurisdictions have since adopted similar legislation, including Norway, the United Kingdom, Ireland, and Canada. And by the way, my Conservative colleague was questioning about Quebec earlier and what the impact of their legislation, which they've had restrictions on advertising to children. Here's the facts. Quebec's restrictions on advertising to children have been shown to have a positive impact on nutrition by reducing fast food consumption by 13%. That translates to 17 million fewer fast food meals sold in the province and an estimated 13.4 million fewer fast food calories consumed per year. Quebec has the lowest rates of obesity among 5 to 17-year-olds in the country, as well as the highest rates of vegetable and fruit consumption in Canada. That's relative to every other province. Now, it is true that childhood obesity rates are rising everywhere, but I think the effect of this marketing is quite clear, that it has slowed the rise in obesity and unhealthy consumption of food marketing in Quebec, partially at least because of their early and I think progressive adoption of legislation that's before the House. Now, I also would point out that Quebec prohibited all commercial advertising that targets children under the age of 13 since 1980. So I think it's very clear that it's time that the rest of the country got in step with this. I think most of us in here are parents or are certainly have siblings that are parents or maybe are intending to be parents at some point. Certainly we're all children. It should be, I think, non-controversial that we say that marketing of unhealthy products to our children in this country should be something that we're very vigilant on, and we should act to prohibit. I urge all my colleagues to support this legislation before the House today. Thank you, Mr. Speaker.